Commissioner. Well, good afternoon, everyone. Thank you all for joining us today. Today, the First Lady and I will be getting our COVID vaccinations along with our flu vaccine. Our message today is very simple and one that I find kind of amazing that I have to deliver. In Minnesota, you have the freedom with you and your healthcare provider to make the decisions and receive your vaccinations. Misinformation and conflicting guidance coming out of the administration in Washington is deeply concerning. We've heard from many Minnesotans who are concerned and confused of the hoops they would have to jump through to try and get a shot. I am here to tell you that is not true in Minnesota. Things are the same as they've ever been. You can go and get your vaccines. You do not need a separate prescription if you're doing it at your pharmacy. It's to make it as easy as possible. And the reason for that is vaccines have been one of the greatest human achievements and public health achievements of modern times. Us being the home of the Mayo Clinic, from the University of Minnesota, and experts in this, we know that these are safe and they save lives. This week, or just shortly, a short time ago, the respected medical journal, The Lancet, published a study showing that over the last 50 years, routine vaccinations have saved over 154 million lives globally. That information is peer-reviewed study from one of the world's oldest medical journals. It is collaborated with our folks at the Mayo Clinic. So if you want information about vaccines, go to your providers, go to those trusted sources. Do not go to your brother-in-law on Facebook who is telling you about vaccines. The confusion that is purposely being spread, unfortunately, by the health department and by a well-known vaccine denier, an RFK Jr., is confusing Minnesotans. And not only that, it's putting them at risk. Just this week, Minnesota Department of Health had to announce we have 10 new measles cases. It would not surprise anyone that all 10 were unvaccinated. We would not have 10 measles cases if people were vaccinated. But the message here is very simple. Minnesotans need to make their decisions about vaccines. We're not going to deny you access to life-saving vaccines. We're going to make it as simple as possible to receive those vaccines. We're going to coordinate through the Commerce Department with your insurance companies to make sure these vaccines are made affordable to you and covered by your insurance company. All of those things go back to why vaccines have saved over 154 million lives and created countless opportunities for people to avoid being sick, and we've seen it in many cases, long-term injuries from this. So I'm just really grateful for the work that's done by all of the folks in this space. I'm really grateful for the Minnesota Department of Health that was very quick to clarify Minnesota's rules, very quick to clarify that we disagree vehemently with the misinformation, false information, confusing information being put out by federal authorities. So here in Minnesota, rest assured, the science is being followed, all the safety precautions are in place, your freedoms of healthcare decisions is being kept in place, and we'll continue to make sure that those access stays available. With that, I'd like to have Commissioner Cunningham explain a little bit about what you'll need to do or where we're at on vaccinations, and maybe a little bit about what this COVID flu season may look like. Commissioner?
Thank you so much. Thank you, Governor. The Governor has said it all this morning. We want to make sure that all Minnesotans maintain access to vaccination if they want it. I agree that it has been a confusing time, but Minnesota got out early in September to clarify, which is why you saw the standardized order come out, to make sure that pharmacists, where many, many Minnesotans get their vaccine, could still administer COVID vaccinations. COVID vaccinations, all of the professional associations are in alignment, say that anybody who wants it over 6 months of age and older should be able to get it. With the CDC coming out and agreeing to ACIP's guidelines to get it with shared decision-making with your provider. That is what we always recommend. If you have any questions, talk to your healthcare provider. Go to them as someone who works with you, who knows the conditions that you live with every day, who knows you and your family well, whether you have a high-risk adult in your household. Talk to them. They will say, most likely, to seriously think about having a COVID shot. It has saved millions of lives over time. It is available at your doctor. It is available at pharmacies. It's available at local public health departments. So one of your best defenses against respiratory disease this season is to be vaccinated. Thank you.
We'd be glad to take a few questions, and we're going to get vaccinated. So we'll just stay on topic first, then we can do the shots, and I'll do some off topic after that. Let the commissioner go. Anyone?
Should people be talking to their doctor first before they get these vaccinations, as RFK and now the CDC have recommended?
So people can go into their pharmacist and have a conversation also with their pharmacist and get vaccinated there.
I mean, what does the research show us? I mean, do they need to have that conversation with
It's-
the doctor, or?
And as we were coming in, and you will see here, with when you sign up and you do a consent to have vaccine, there's an opportunity to talk about your concerns, about your fears, to allay misinformation. This is a time that is very confusing for people because there are a lot of different narratives about the safety of vaccination out there. What we know, and when we look at the science and when we look at it with our professional associations, our vaccines are safe and effective and save lives. And so I would encourage anyone who has a question to reach out to a healthcare provider, whether it is a pharmacist or your primary care provider, and have that conversation. And as the governor said, go to a trusted source, not social media, not your cousin, right, not Facebook. Go to a trusted source who is trained and who can answer those questions and help you think about what is best for you.
Commissioner, do we have a sense of how severe COVID and the flu are this season?
So at this point, we're still looking at that data to come in. It's still relatively early in the season, but we know, and part of the reason that we encourage and follow the Academy of Pediatrics guidelines was because for the young children, the children under 2 years of age, half of the hospitalizations were in kids who did not have a pre-existing condition. And so it is something that families should particularly think about for the youngest among them, also for the elders who are also particularly vulnerable, and certainly anybody else with a high-risk condition. But in general, COVID has been found to be safe and efficacious for all of us, and so that is why the guidelines from multiple medical societies say, please think about getting your COVID shot.
Commissioner, a lot of people are confused about not only whether to get the shot or
Yeah.
not, but if they do get it, do they have to pay for it? Is it still being paid for?
Right.
And this is having the effect, potentially, of suppressing the number of people who bother to go and get it. How big of a
Right.
problem is that?
I think that is a problem. And so I would love for our insurance plans to come out and be very clear with their members about the coverage for COVID vaccines. With them covered by ACIP, with the CDC signing off on ACIP's recommendations, they should be covered because that is what insurance follows. But certainly in Minnesota, even if ACIP departs, I think we can have plans, and they have said to us even before the ACIP recommendations came out, that they were still covering those vaccines for this year. We always recommend, just as I say, talk to your doctor, to call up your insurance plan to make sure you're not caught with a bill. But my understanding is they are paying for it.
Just as a quick follow-up, so if a Minnesotan is sitting out there going, I'm hearing this from RFK Jr. and the CDC, but I'm hearing this from Minnesota health officials, who should people listen to?
Us. 100%. And this is not he said, she said. Yes, it's us. And this isn't me. This is not me saying this. This is every major medical group, every major research group, Mayo Clinic, everyone, all of the facts saying these are safe, you should do them. They are providing you no data for saying no. They're providing you nothing other than a gut feeling that they have against this. I haven't ever witnessed anything like this in my time. I don't know, Commissioner, if you have. But I think Tom's question was really good. The confusion is part of the plan. That is not a bug in the system. That is a feature of what they're trying to do. They simply do not believe in these things. They have bought into these myths. It's the same thing around the Tylenol and autism. There is no data to support what they're saying. So this is all incredibly confusing to people. I'm not telling you to listen to me. I'm telling you to listen to every medical group in the country. I'm asking you to listen to folks like at the Mayo Clinic, to the researchers, and they are going to provide you on the other side nothing to support their reasoning for not getting these things other than a personal belief.
Governor, are you surprised to find yourself in this position on a variety of issues of contradicting and
Yes.
challenging the federal government as head of the state government day after day?
Yeah, every day. This is not the way it should have been, that we had partners in this. And this wasn't it if we disagreed, and I said this with other administrations, we may have disagreed on some of the policy issues. We never disagreed on the legalities and the procedures that went forward, that we could count on this. Having conversations with folks on another unrelated topic, but it's very similar on this, the confusion around FEMA and FEMA's requirements. FEMA's no longer going to be there to provide some of the housing and some of that assistance that we've come to. So what we're doing is we are simultaneously planning on that the state is going to have to pick up for this. And I think it's just a pure blessing as a country that we've not seen a hurricane season ramp up yet. It may come later, but from all the experts out there, it's the same type of situation. Now, maybe when it comes to vaccines, you know, it's not as apparent on this, but I absolutely know for a fact, if you look at the Lancet study and the number of, if they're telling people not to get this, certainly in that cohort of folks who may be confused and not get it, they are going to kill people doing this. And I am just flabbergasted by folks who are sworn to an oath to protect folks and make sure that this is out there. This is one of the greatest human achievements of the last, maybe ever, are vaccinations. And people are like, oh, kids were fine before we had vaccinations. Kids were not fine. Infant mortality rates were off the charts. Our children live today in main part because they get good prenatal care, they get vaccinations, and we're on top of these things. And I would just add, on something like measles, for the families who have immunocompromised children who can't get certain vaccines because of where they are, those children are depending on herd immunity to keep it out of their circulation. They don't have that protection now when we start to drop our numbers. And Minnesota's always been very, very good about this, but like I've said here, we have folks that serve upstairs in this chamber. They're asking us to get rid of all requirements for vaccinations at school. That is reckless and dangerous. So yes, this is an amazing thing to me. The good news is what I would say, the chaos, the things that they're trying to create, the things of trying to get people spun up. Here in Minnesota, we're following the science, we follow the data, our providers are there ready to provide, and things are normal and calm, just like they've always been, to go out and get your flu vaccine. We've added COVID to that because it's a new respiratory illness. This is things that in the past were not controversial. They weren't even partisan at all. This is just a new thing. But here in Minnesota, as you're going to see us, we're going to get safe, effective vaccines to keep folks healthy.
Commissioner, may I ask, if you press your doctor, safe, 100% safe, the doctor says no, nothing's 100%
That's
safe.
right.
There's a small risk. You might have an anaphylactic reaction.
Right.
You might, with COVID, have one in certain population
Right.
viruses. Small risks exist. So when you
Right.
say safe, there are risks there. Can you help put in context those risks?
Right.
They do exist.
Thank you. The risks, though, when you look at a population level, are relatively rare. And so you have to balance them against the risk of hospitalization. You have to balance them against the risk of long-term COVID. Because what the data also shows is that people who are vaccinated who actually end up getting COVID, they are less likely to have long course COVID. So, and we have to think about that because that is really debilitating for people. The other risks that I would encourage people to think about are the risks to others, right? You have to think about your family, right? You have to think about the people you work with. You have to think about the people you live with. Certainly in congregate settings, certainly in long-term care, other places where people are living together, right? We want to think about our unhoused, people who are in shelters. We got to think about everybody as Minnesotans, and that's what public health does. And I think that's what Minnesotans do, right? I think they think about their community. And so people often have concerns, right? They often need that counsel. They often need time to answer a question. And I would encourage everybody to do that. I really believe information is power. It helps you make the right decision for you and your family, your loved ones, and your community. And so yes, they're there. It's not that there's zero ever adverse incidents, but most of the times that doesn't happen.
That's a technique too, I might add, folks, because the folks who are the naysayers, that's a technique, because they're right, you're right, it's a good point to bring up, it's not 100%. But I can tell you statistically, my chance of being injured in the drive from my residence to here was higher in that car because of car accidents statistically. It doesn't mean I'm not going to drive here. So I do hear you on that, but it's a statistic that I'll hear that, well, you know that it's not perfect. And then when it does happen to someone, which there are those are certainly tragic situations, but that's the part of trying to reduce those odds. But the fact of the matter is, as the commissioner said, the risk of COVID, the risk of long COVID far outweighs the risk that you have a reaction. And by many people, you already know fairly early on whether you're going to have these. And the questionnaire I filled out asked me many of those questions for the provider to be able to determine maybe I shouldn't give this person a shot.
Commissioner, do we have any numbers on whether Minnesotans
So over time, what was happening in Minnesota is happening across the country, right? As the governor mentioned, there's been a campaign of misinformation. And the average person, it's hard for them to sort that sometimes, which again is another reason to go to your doctor. So unfortunately, trends have gone down over the last 5 years, but we want to see them come back up, right? And so part of our responsibility of public health is to talk to people, to go out into the community, to make sure that vaccines are accessible to everybody, and to answer those questions. So what we have done, and I encourage everybody here also to take a look at it, is to look at the Minnesota Department of Health's website, to look at our guidance, to go to an event that may be in your community where local public health is talking about vaccination. Certainly, when I talk to physician associations, they are also talking about other strategies, right? So yes, come talk to them. They recognize that, but they are also encouraging their members to get out in the community, which is another strategy, and talk, be a community health provider, be a community doc, and talk to people in your neighborhoods, you know, perhaps at the PTA meeting, right? Perhaps at the church congregation. Show up in those ways so that people can have access to you, they know you, and you can answer their questions in those settings too.
You mentioned a rare side effect of myocarditis, and I don't know if you addressed this, but have you seen studies comparing the rate of myocarditis in cases of folks who are vaccinated versus folks who are not and get COVID?
I have not looked into that, but certainly happy to do that and to follow up.
Right.
Should we get these vaccines?
Yeah, let's do it. Well, everyone here knows that Tom Hauser beat me by 2 minutes in the run, so we're very clear about that. So it was a beautiful day.
Until you do it in front of the microphone, it's not very clear.
So that's right. Tom Hauser did run 2 minutes faster than we did on the. It was a beautiful day, a great race, by the way. Well done. I am in on the 10K turkey trot on Shepherd Road, Tom, on Thanksgiving Day. We want to have another one of these. So.
It was too hot.
It was hot.
Or you did the marathon.
Today would have been perfect. It was hot, by the folks. It got really hot. You had like 6 different types of weather. You got rained on. It was windy. Then it was sunny and really calm. Thank you. It is concerning. Well, and the thing is, it's easier to just say no because you know you're not going to have a reaction. You're fighting kind of proving a negative. So. It's a little bit traumatic. It feels a little traumatic though, because those times during COVID when the first ones came in, and if you remember that time, everybody was waiting for them to come in, and we were there when the trucks came in with the shipments because it was that big a deal. All right, look at that. Hundreds or thousands.
I think we do over 70,000 each year.
That's a lot.
Left arm again.
Left arm. Right hand.
We'll want to move that hand around.
Want me to hold your hand or anything?
I know. Please do it.
You looked at your consent form already and you're good to go?
All good.
All right, this is the arm you want.
Arm on one.
Okay. Do you like a countdown or should I just do it? You do it. You're a very brave patient.
start doing this. It's like a Don Johnson or something. I'm kind of like liking this now. I did it on purpose. Yeah, I did it on purpose. No, that's right. We get it out of there. Anything off topic? Yeah.
Governor, clergy delivered a letter
Yes.
yesterday, 700 members with
Yes.
54 counties have signed it, calling for you to call a special
Yeah.
session. Are you ready to do it?
Yeah, look, and I think what they recognize is calling a special session is the motion to put things into that, but it's the results that we're looking for. Nothing has changed in terms of Republicans are absolutely clear. I want to be clear. There's no misunderstanding. There's no mischaracterization. Every special session that's ever been held, you have an agreement where you go in. We put an offer forward, which we released, and said we're willing to hear some of the things that you're bringing up. As I said, I am always encouraged whenever there's a school shooting, Republicans want to talk about more funding for mental health care. They normally don't vote for it, but I'm glad that part of it's there. But this is a discussion about guns. This is a discussion about safety. These clergy were very clear. They want us to go into a special session to have a discussion about high-capacity magazines and weapons of war. I am still trying to get Republicans to simply do, and I don't know how many times I can stress this. If you believe getting rid of those weapons is a bad idea, then you should be proudly on the floor upstairs voting no on a bill to ban those. And then you would make your position perfectly clear to your constituents that you disagree with the governor, you disagree with the clergy, you disagree with the doctors, you disagree with the parents, but you want to make sure that you're heard on that. I think at some point in time it becomes very, very difficult to make the argument. And then I said, if you don't want to do that, and the argument I believe was made, we need more input. We need more input from people. Well, the ultimate input of this is put it on the ballot and send it to the public for a constitutional amendment. And that's all. Then you don't have to take responsibility for that. The only thing you're voting on the floor is that you are voting to turn this over to the people of Minnesota and let them vote. And that seems to me that would be a very simple solution to this. It's what we're asking for. At this point in time, I'm getting no guarantee. In fact, I'm being told it will not happen. We will not have a vote on either of those two things on the floor.
So will you still call?
I could call it.
You just happened to vote.
Yeah, I could call it so that this would happen. They would come here and we would pay them and they would go through this stall technique and we would never ever see a vote on those things. We would never see a vote on it. And so for the efficiencies, well, that's what we're still trying to figure out. I can tell you what I'm going to do is that I'm going to be at town halls with some of these folks, these parents, and with these clergy, and with doctors, and with others, and just saying. And again, I want to be very clear. I'm just asking you to state your opinion on this. If this is a bad idea, I respect the democracy. If it's a bad idea and you think this is a bad thing, it's not going to make a difference. I will mention, though, this very same argument was made about red flag laws. And they all voted against it. And they were angry that it came up for a vote because there are many floor speeches you could all pull by these very members who are saying the governor's being political, this won't stop violence, this won't improve anything. They use those exact same arguments on red flag laws, and we have the data now to know that's absolutely false. Lives have been saved. The only thing about the red flag laws is they need to be used wider. So I'm going to make the case on this again. These very people who voted against red flag laws voted to make Minnesota less safe. So I'm going to go out and make that case if that's what's necessary. I certainly could call it, but what would happen is because of the tie, it would just grind to a stop. So we would be having this same discussion, but we would be officially in session. That has never been done before. We come to an agreement, and I will note that the list of things that the Republicans wanted done, which of course no mention of guns, I said I'm certainly open to that. And I said, our folks will vote on those. I said, you should just simply do the same thing.
Governor, the Annunciation shooting was in August, it's now already almost mid-October.
Yeah.
Does there come a point where it's too late to do a special session with a regular session in February?
Well, I don't think it's ever too late, but I do think what you're seeing is that I will give them this, the folks who don't want to take this vote or have this discussion are becoming fairly will forget. But you saw steps of the Capitol with the parents, with where Minnesotans are at. This is not going to go away. And we've had several school shootings, of course, since this one. The question then becomes, does it make sense if you get further into that you bring this up in February? I hope we get a resolution before then. I think we owe it to the people of Minnesota to have a resolution before then, but it's a valid point.
What's the likelihood that you will call one way or another?
Well, I think at this, it's hard to tell. I need to get an agreement on this. I need to have it, if we're going to hold a special sessions on safety of our children and safety of our streets and safety on gun violence, we need to talk about guns. And if the folks who hold veto power over this, which they do because of the makeup of the legislature, if they say that's not going to happen, calling a special session is going to be a waste of money and a waste of time if they're not willing to participate honestly about what it's going to take. And again, all I'm asking is this. I believe, and a large number of people believe, that we can do something around these weapons that fire 116 rounds into a church in 90 seconds. High-capacity magazines means you don't have to reload, so there's no chance to interfere with that person doing it. I believe, just like I did with red flag laws, that we could actually save lives if we did that. So I'm asking them to go to the floor, to debate that proposition, and then cast your vote. And if there are 67 in the House, Republicans, who think that's a terrible idea, then just vote 67 no's and it will fail, and that will be the end of this discussion, and we'll have to approach it somewhere else. So there's no mischaracterization here. The very simple part of this is they do not want to have a discussion and a vote on guns. And I say that not belligerently or anything. If I'm wrong, just vote against it. I'm not even getting the opportunity. The parents are not getting the opportunity. The clergy's not getting the opportunity. The doctors are not getting the opportunity. The majority of Minnesotans, when they're polled, are not getting the opportunity to even have that discussion. So I'm going to continue to push them. I'm going to continue to ask. This would all be fixed. Let's just go to the floor. Let's have the vote. It either passes or it fails, and we will move forward. But my commitment is to protect Minnesotans. I knew the data supported red flag laws. I knew that if Minnesota enacted red flag laws, we would not interfere with anyone's Second Amendment rights, and we would save lives. That was a good step forward. Can more be done? Absolutely.
But Governor, it's not even clear that the Democrats, that there's the votes on the Democrat side to pass.
Sure, they can vote however they want to.
But my point of saying that is, it doesn't get to a point where you just have to be transparent with Minnesotans that the votes might not be there on either side, so it's a moot point to have the special session.
But the Democrats aren't saying don't vote. The Democrats are not saying don't have a vote. The Democrats are willing to say we have a vote. Will we lose some of our members? Maybe. That's their conscience. They can vote how they want to. But the Democrats are not saying not have a vote. The Democrats are saying we agree to put this on the floor and have a vote. That's the question. Just have the vote. I don't know how they're going to vote. I don't know. They might all vote against it. The question is, why are we not having a vote on it? And that's...
They didn't say that they're, in the House are not going to bring up such a vote. So, I mean, what...
The House is going to bring up a vote.
The conversation now from what has been happening over the last several
The public,
weeks on this.
700 clergy telling us to have a vote on this. I mean, it's the public's going to ask. It's overwhelmingly popular. I think the recent polling showed it at like 58%. People want to do that. But don't get this very clear. The Democrats may not have the votes. I don't know. But the Democrats are saying, we go into special session, we're going to vote on an assault weapon ban and high-capacity magazines. The Republicans are saying, we are never going to have a vote on high-capacity magazines. That's what they made clear, both in private and publicly. So that's a very different position.
Can I switch gears just for a second?
Sure.
Something that you said yesterday at the summit, the lead Sergeant Summit.
Yeah.
You talked about preparing for the possibility
Yes.
of deployments here. Could you just clarify a little more? I mean, what does preparation look like? Have you heard anything from the
Yeah, and I think this has been going on for quite some time, and we've seen it, whether it would be in LA, whether it's Portland, or now in Chicago. It's first and foremost starts, what are our legal rights on this? The legal rights of working with the Attorney General, working with other states, what our legal rights would look like. What would that mobilization look like if it were troops outside of Minnesota coming in? What would the chain of command look like? What would happen with our troops? How would we try and make sure we're coordinating to know, it would be nice to know that we have several hundred armed people down in the Loring Park area. Local police should know where they're at and those type of things. We're trying to figure out what would that chain of command and communication look like, and how would we talk to the public? Because I just want to be clear. All of this is meant to be a distraction from a government shutdown, from an economy that's not working, from soybean farmers collapsing, from Epstein files and all of that. This is not meant to make an impact truly on crime, truly on safety in communities. They're pepper spraying Portland frog. That's the thing that's going on. That is the nonsense that's happening in the midst of this. My goal is to make sure Minnesotans remain calm, know that things are in place. If they do use federal troops, which he can attempt to do, we will challenge in court. If he tries to use the Insurrection Act, we will challenge that. But in the meantime, should he step through those things, do that anyway, here's what we're going to do to make sure that chaos doesn't reign. Minnesotans are going to go about their work. We're going to continue to not play into and give them photo opportunities. Because I don't know what you've seen in Portland. The only chaos I saw was honestly a guy in an inflatable frog suit getting pepper sprayed. Or you've seen in Chicago people being inadvertently shot or people being detained in ways that far exceed the authority of it. So I think the preparations are making sure our legal aspects are there, what we're going to do to make sure our operation continues, what our responsibility is to respond to them. And I once again, as I mentioned yesterday at this event, when there was a federal overreach by the Biden administration, I, as the co-chair of the Council of Governors, organized a letter pushing back and demanding that the Biden administration change their positions to state sovereignties and rule over our National Guard. All 50 governors signed that letter, and it is the exact same situation you're seeing now. And in that case, the Biden administration was trying to remove National Guard troops from the Space Force and put them in the active force. It wasn't a proactive troops in the streets type of thing, but it was an infringement on state sovereignty and control of governors over the National Guard. Every single governor, including Greg Abbott in Texas, said this is an outrageous breach of what our authority is over the National Guard. Now all of a sudden, they're silent and they can't say anything. So we're preparing with governors. I'm still trying to get them on board to say, look, what was good for the Biden administration should be good for the Trump administration, that you do not have the authority to do this, and you're not adding to the safety, you're adding to the confusion. So that's what's happening right now.
Governor, can you just comment quickly on the government shutdown? Has anything changed from the last time we spoke about it in terms of
Yeah, I wish I
state services?
Yeah, I wish I had MMB here, and we're monitoring what all of you are monitoring. Airport operations and some of those appear to be slowing down. Again, that's a federal operation with TSA and some of the controllers. I think for us, we're still gathering information on it. We're seeing, no responses to things that's not that unusual now if we're trying to ask. I will make sure if we get MMB maybe to get an update this week if we talk to them to see if there's been any change in appropriations, in money coming. We've had the list of where the clawbacks have started to happen separate from the shutdown, and now to understand the shutdown. But again, here we are a week into this chaos. We're talking about immunizations. We're talking about preparing for fall weather. We're getting, we'll be having our, name the plow truck contest and getting ready for winter safety and all those things. That's the things that governors and local governments do, not understanding that the federal government in a gross overreach is coming into here. So we're still assessing it, but again, they're shut down. But thank you all. I'm going to give my last plug. Get out there, get your COVID and flu vaccine scheduled, protect yourself and your family. We'll make sure we have a healthy fall here in Minnesota and continue to move forward. So thank you all. First Lady, thanks.
It hardly hurt.
It didn't hurt. Look at it. I'm like,
Just,
working
yeah.
on it. Thank you.